Here today with Buzz Stewart from Medcurio, and Buzz caught a little of your presentation to the group here at the HITLAB Innovation Summit. This is, you played it like a real pro. I didn't realize that this was your first time here.
Ah, thanks.
So tell me a little bit about your presentation and what you were trying to get across to the audience.
So I've always believed, I think, since I started in working in health systems as a research leader, and that was going back to 2003, that automation was going to be essential for health systems ultimately to be successful.
Mm-hmm.
And you could see it unfolding, and it's continued to unfold from what I consider to be two dominant pressures. On the cost side, labor accounts for more than 60% of healthcare costs, and that tends to increase faster than inflation. On the reimbursement side, publicly funded insurance is taking a growing share of all reimbursements.
Mm-hmm.
And so the average reimbursements are going down over time, and they're going to continue.
Yep.
So that squeeze from both sides is creating intolerable pressure. One consequence is that quality and access erode. And so it's nothing new to any business, but the ultimate solution basically is that you have to figure out a way to do more with less. And in the modern era, that would mean automation. And I would say that especially with the emergence of AI, the opportunities, I think, to really transform in a sustainable way to offload those pressures, I think, is sitting right in front of us.
Mm-hmm. So what systems and procedures are ripe for this kind of transformation?
You know, I think of the back office, and I think of the front line. In the back office, you have things like revenue cycle management, to the extent that you can automate the whole stream of work that needs to be done, and there are a number of steps, 11 or 12 major steps. You could pick up lost revenue. You can get money faster, so the cash flow is better. But in almost all those steps, electronic health record data is required
Mm-hmm.
to make the automation work. There's supply chain, and supply chain management is really important in making sure that you're optimizing resources, because if you're running out of supplies, then you may not be able to do certain procedures and things of that sort.
Right.
There's resource optimization, so making the most of your beds, of your visit slots and things of that sort. And then there's the actual front line of care, where we can not only, I think, with automation, offload work for doctors and nurses in ways that allow them to spend more time being doctors and nurses rather than documenting, rather than answering all of the patient messages. I think technology can come in and actually enable that in ways that we're just beginning to see, but we're not even close to the potential.
Mm-hmm.
So there's lots of areas where I think automation can factor in a way that would be transformative.
Do you think that some hospitals and healthcare systems and practices, though, are just generally going to have to take a really hard look at what they're doing and maybe change some of their core objectives to deal with the squeeze that you're talking about?
I think the world is divided between the larger systems that can afford the assets to begin to think about automation. I don't think many places are thinking about automation or acting on it because there are constraints in being able to move data in real time to automate.
Right.
You can't automate without data. That's why Google Maps is so successful, because moment to moment, it's accessing data in real time to give us moment to moment guidance. Healthcare is the same way, that you need to be able to move electronic health record data exactly where you need it to automate processes. So it's only, I think, the larger systems that have the resources to try to think about that. And I think the systems that have less operating income don't have the resources. So I think the squeeze is probably felt more there than in the larger systems. But I do think that the opportunity, and this is what I'm excited about with our technology, that the opportunity to leap forward is bigger for the smaller systems. because it's almost like going from an underdeveloped economy where you have no phones, and then 5 years later you have cell phones. You've leaped a generation without having to pay for any of the infrastructure to get there. And so I see that opportunity, I think, for both large and small systems, to the extent that they can get control of their own electronic health record data and use it the way they want to.
So really, your system works, but first you kind of have to diagnose the patient, don't you?
Yes.
Yeah.
Yeah. I actually think that health systems, it's interesting when you look at the anatomy of the C-suite and the levels of the C-suite. The oversight of trying to do things more effectively with electronic health record data is split up among different groups, and all of them seem to want to have a hand on automation. What health systems are missing is a chief automation officer, or at least a COO who is automation focused, because that is going to be the way in which systems and healthcare in general in this country is going to find its way out of what is becoming a intolerable squeeze, I think. And patients are paying the price for that, I think, at the end of the day.
So what is the outlook for your company and your business?
I'm excited about where we're going. I think we've got some great channel partners that we're working with. We sell directly to health systems, but we also have been working for 2 years on different channel partner relationships. The one that we're furthest along on is Salesforce. And it turned out, not coincidentally, that our first use case with a health system was that they couldn't get data, electronic health record data, to port over to a Salesforce workflow to automate the workflow. And so they more or less had shelfware. And so they used our technology to solve that problem, and then rapidly expanded the use of Salesforce. So we have a partnership with Salesforce with a complementary technology that we've developed that not only enables systems to easily get their data and move it where they want, but to automatically map it to a cloud so the CRM can use it. So we've simplified the whole process of getting data where it needs to be to begin to automate. And I like the Salesforce arena because it's where I've seen really impressive stuff being done for patient support services. And I think that that's always historically been an area where we've always said we got to be able to do care coordination. We've got to be able to give patients guidance on long journeys. And we've never been able to do that, right? It's because most of the work is the matrix outside of the encounter. And to the extent we can find very cost-effective ways of doing that really well, that's a huge win for patients and providers and payers. Everybody wins on that scheme.
So I'm curious about the reaction you got to your presentation, because you walk in as the purveyor of gloom and doom if you don't do something, but you do offer a solution at the same time. But most of the messages that we get in the room are pretty rosy, or at least optimistic, or have shiny, sparkly aspects to them that everybody likes. And yet I look at you as kind of the voice of reason from 30,000 feet right now.
Yeah, I got a lot of great feedback. Positive feedback, lots of really good questions. Actually, even though there were some glitches in with some of the slides and things of that sort, and I had to do a little dance on my feet.
Right.
I enjoyed the feedback both yesterday, and I got more today. So a number of folks stopped by, and I was pleased.
Yeah. How important it is for you to have a platform like the HITLAB Innovation Summit to talk about and really, lay down what you just laid down?
I think that it's a unique organization. I've never interacted with an organization like HITLAB, and it both is the know-how of the organization. There's kind of a calm about how you get things done, which is reassuring. I think that the opportunity to come to a meeting where you're meeting investors and health systems and other startups is exciting. I can get that at Health and Vive, but here it's just much more intimate, much more connected. More interactive, I think. I think that the kinds of calls that we have week to week and the things that we're doing, I view as not just important steps for us to identify investors that would be interested in us, but finding investors that we would really like to have a relationship with.
Right.
So no, I think we're still on the early journey, so I'm looking forward to more, but it's been a good journey.
Yeah. Yeah.
Yeah.
Well, good luck moving forward, Buzz. Appreciate you taking the time to talk with us today.
Thanks so much.
Thank you.
Appreciate it.